record on. Perfect. Just double checking it's recording. All right. My name is Tyler Urness, and I'm conducting an oral history interview as a part of an effort to archive the effects of the COVID-19 pandemic for individuals and communities in the Midwest for both Western Wisconsin COVID-19 Archive and the Journal of the Plague Year COVID-19 Archive. Today's date is May 6, 2021. As of now, there are in the United States total cases of 32,356,034. The total deaths in the United States is 576,238. Of that total, Wisconsin's total cases are 601,603, and Wisconsin's total deaths are at 6,877. Today, we will be speaking with Aleah from the Eau Claire, Wisconsin. Aleah, thanks for taking the time to speak with us today and for sharing your experiences for this pandemic. We appreciate your help and perspectives for this project. So if you wouldn't mind, can you state your name and any demographic information for the study?
Yeah, my name is Aleah Anderson. I have been working for the Eau Claire City County Health Department for the last couple of months. I was hired back in December, and I graduated UWEC with a bachelor degree in public health. I'm 25 and yeah, excited to do this interview with you.
What are the primary things you do on a day-to-day basis for, like, example, like your job, like you said, and extracurricular activities?
Yeah, so for my job, what I do is I call positive cases for COVID, and I go through their symptoms. We talk about their isolation dates. I give them an isolation order, and then we go through contact tracing. So I ask them different questions. Where have you been for the last 2 weeks? We go day by day, listing any close contacts to them. And then I make cases for their close contacts, and I call their close contacts and quarantine them. And we go through all the quarantine information. And our biggest goal is just to document everything the best that we can and make sure that everyone has access to things that they might need, like food, groceries, different errands that might need to be run that they can't do, letters for work, different situations like that. We even have some social service people that can help them apply for unemployment benefits if they need it. So we're really just trying to provide resources for people going through COVID and being exposed to it as well. And then in my personal life, I've been recently doing some walks now that the weather's been nice. I got my second dose almost 3 weeks ago now. So this last week I've been fully vaccinated. So I've been starting to kind of see friends again, really small circles. And then, yeah, just staying home basically with my 3 pets. Yeah.
All right, perfect. Where do you live, and what is it like to live there?
I live in Eau Claire, Wisconsin. I've been here for almost 5 years, and I really enjoy it. We bought a house here, almost 5 years ago, and we have about an acre of yard here, and it's fenced in for our dog, which is nice. And we live like right downtown, so we have walkable access to different things. We're right across the street from the beach, which is nice. So we go kayaking, and we just got a paddle board. So we're planning on doing some water trips. But yeah, it's been really enjoyable. Yeah, I really like living here.
Do the dogs like the water?
My dog does not. He's older, so he spent most of his life not near water until until we moved to Eau Claire. He's 15 now, so it's been in his later life getting used to the water, but we do have a life jacket for him, so we make him do it because it's a really good exercise for him. But yeah, he's not the biggest fan, so we don't make him do it for very long.
Okay. When you first learned about COVID-19, what were your thoughts on it, and how have your thoughts changed since then?
Oh yeah, so back January, or maybe even like December 2019, it's starting to show up on the news and BBC and stuff. My partner Connor, he is really into reading the news constantly. He was like, like his ears perked up immediately. He's like, Aleah, like this is serious. Like this is gonna come to America. It's gonna be a really big deal. I was like, no, no way. It's just like a couple cases. It sounds like it's just like the flu. Like there's nothing like particularly alarming to me. And it's like, I don't know, sounds like it's gonna be a big deal. And then a couple months go, or yeah, it's like I think it was January, maybe even February. He was talking about like, oh, like taking like almost like not real bets, honestly, or obviously, but just like, oh, I bet everything's gonna close down like beginning of March. I was like, no, 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 I don't think so at all. I really don't think that's gonna happen. And then March came and we were still full-time university students back then. It was like right before spring break when everything shut down. And at first I was like, obviously this is a really big deal. This is a really scary situation. Everything has to be closed down for a reason. Obviously, not having the best faith in the government at the time and how they're going to handle it. The funding was really minimal back then as well. And then all the resistance to wearing face masks and social distancing and all of that. But I was really grateful because I was like packed with schoolwork. It was right before spring break and the extended spring break, right as I was having like a mental breakdown about how much classwork I had. So I was grateful for the break. I was like, okay, things are gonna bounce back to normal pretty soon after a couple of weeks here. And then no, after that I really quickly realized this is here, this is serious, this is impactful. So that was kind of my beginning experience with it.
What issues have most concerned you about the COVID-19 pandemic?
Oh, that's quite a big question.
Yeah.
Obviously, people's lives are being altered permanently from this. I think that's the biggest deal. Yeah, I mean, I don't have a ton of like really personal experiences with anyone being affected directly in my life, except for it's a little unrelated, but a really close friend of mine had a liver transplant before the pandemic, and then she died due to an infection. And I couldn't go to her funeral. A huge reason why she didn't get the medical attention she needed was because hospitals were so booked. She lives in the cities. So they had to wait until way too late to go to the hospital, and then she died as soon as she got there, and she was 27. So that was really hard. That happened like end of March. But yeah, it wasn't like directly due to COVID, but I'm sure that if COVID wasn't here, then maybe she could have gotten the attention that she needed faster. But yeah, it's been trickling into every aspect of our lives at this point. And now obviously working for the health department and working hands-on on this issue, like I'm talking to people every day and they're telling me about their stresses, different things that are concerning them. A huge thing that I hear a lot is that people are really worried about losing pay, not getting sick leave. Their work isn't allowing people to take off sick anymore. People are being forced to work when they have symptoms. So that's been like the biggest challenge, is really getting like corporate America to be accessible for what we need to do to deal with this pandemic. So it's just been a huge, honestly, fight for people to just get their basic needs met now. And then let alone if they get seriously sick. I've talked to a few people that are in the hospital and doing contact tracing for them, which is definitely interesting. But yeah, I hope that's just a really big question. So.
Yeah, I think you covered it.
Okay.
What we just started talking about, next section would be employment. How has COVID-19 affected your job, and in what ways?
So yeah, that's like one of those really weird things that as a college graduate, everyone worries what their what their next job is going to be, if they're going to get a job in their field, how soon they're going to get it. I got my job, actually, my job position was emailed to me by my epidemiology professor. So I had classes that this last fall semester. He emailed that to me and I applied. And then like a month later, I almost forgotten that I applied to it. I was like, no, they don't want me. And they called me and they're like, yes, can you please start working as soon as possible? It's like, okay. So I was on the team and then I graduated 2 weeks later. I was fully trained in, and then I've been working part-time technically since then. So
Okay.
yeah, so it's pretty interesting. Like I have this job because of the pandemic. So I think that's where I fall into a weird category of like, I have employment now because of this. So it's a weird thing I'm grateful for, but obviously the circumstances are really serious, and I definitely respect that.
Yeah, like a reverse of the common scenario. What
Mhm.
concerns you? What concerns do you have about the effects of COVID-19 on your employment and the economy more broadly?
Mm. Well, with my employment specifically, it's a little interesting because when I signed my contract for my work, it said temporary employment through May, like at least May, and now it's May, so it's like, okay, do I still have a job? Like, they recently came out with a statement of, we don't know how long your position's gonna be. Like just really have to go with the flow of it. And that's just been like the whole time working for the health department is constantly adjusting to all the changes. There's new evidence, new information to learn about all the time. Policies change constantly. We're just figuring this out as we're going, and learning as we're going too. So it's been a really dynamic situation with my work. I do think that I'm going to be employed for at least a couple more months. They kind of went through a bit of a downsizing. So our team is a little smaller now. Um, but then for the economy as a whole, I think that it's going to bounce back pretty quickly. I think that I feel like the biggest thing that this pandemic has really shown us as a country is that our systems are very flawed. I think we all knew that before, but it really does not have any give for people facing really real situations, especially financially. And I think we really saw that with the kind of honestly the failure of the stimulus checks coming in time. And I felt that too, because like that there was supposed to be like a stimulus check in August, and I literally ran out of money right before that was supposed to happen, and I defaulted on my own bills. And now that really severely affected my credit score, and I'm still working on fixing it, even though like it was out of my hand. I especially back then, like I wasn't working back then. I have damaged lungs. I'm a vulnerable person, and it's been a huge concern to me this whole past year that if I was to get COVID, like I could be one of those people that end up seriously damaged for the rest of my life, could even be, or yeah. So I decided not to work. But then I ran out of money. Yeah, so that was interesting. But yeah, I think in the future things are gonna evolve. I think that especially with the new administration, there's gonna be way more focus on helping people that are in a financially difficult situation. And now we're really seeing companies having honestly a lot more compassion, a lot more leeway about different things because it's a collective thing we're all going through now. It's not just like one group of people, it's everyone. So I think it'll bounce back pretty quickly.
Yeah,
Yeah.
perfect.
Mhm.
Uh, has the COVID-19 pandemic affected the employment of people you know, and in what ways?
People I know. Um, I did have a friend that was laid off. She's still not working currently. Um, she worked for like a tech company. She's in the computer science field. Um, I don't know a whole lot about her situation. A lot of my family members are retired. They're a lot older. Um, and then I have a lot of university student friends.
Yeah,
So Yeah, not I haven't noticed a huge impact on my personal friend circles,
Okay.
employment. Hmm.
The next section would be family and household. How has COVID-19 affected you and or your family's day-to-day activities?
Mm. Oh, sorry.
No problem.
Oh, okay. Sorry, my phone's dying. Um, our day-to-day activities. Well, I think that at first it wasn't a huge difference. It was just like, being more careful, wearing face masks, social distancing. But, when the pandemic first hit here, it was a lot warmer and it got warmer. Like it was springtime into summer. Summer was pretty casual, like it was pretty typical, except for I didn't see my more vulnerable family members. So I haven't seen them at all since actually yeah, no, it was the Christmas before the pandemic. So I haven't seen a lot of my family members since then. Um, but my friends I've been seeing, people who aren't in vulnerable groups and then just wearing face masks and social distancing. And then winter happened and I did not see anyone for like 2 months. I didn't leave my house. I just worked from home. I got my groceries delivered. Cases were really intense. Like we didn't feel comfortable seeing anyone at that point. So we switched everything to virtual, hang out with people online, all the games that came out, like Among Us, stuff like that, and watching movies virtually. So we just kind of like pivoted, did everything online as best as we could. I called my family more often than I used to. Um, but yeah, I guess it wasn't too terribly different, except for we just didn't go out.
Okay. What have
Mm.
been the biggest challenges that you have faced during the COVID-19 outbreak?
Um, I think probably, uh, yeah, just really missing my family has been the hardest part. I haven't, well, I saw my mom a couple of times really briefly. My mom is in her later 60s, so she's in a more vulnerable population as well, and she doesn't have health insurance. So it was really extra concerning that, we don't see each other. And I get to see my mom next week. We're both fully vaccinated. So, or not next week, this weekend for Mother's Day. And I'm gonna hug her for the first time. Well, I think I hugged her in the summer. We did like blanket hugs where we just like put blankets in between us and hugged, but probably wasn't still the safest thing to do. But that was when cases were a lot less concerning. It was summer. So um but yeah, that's been the thing I've missed the most was just getting to see my family and be with them in person and hug them. And yeah,
I'm sure you're looking forward to that. What have you,
yeah.
family, and friends done for recreation during the COVID-19 pandemic?
Yeah, like I said before, so just playing games online. I got a new laptop that could play games better, and watching movies virtually. I actually helped kind of reconnect with some of my more long distance friendships. I have friends that live in Germany, so we've been playing virtual games as well. Um, and that's been the biggest thing is just trying to do everything virtually. But in person, back before winter happened, we would do like social distance hikes, or we'd have fires in our yard, but we'd all be like 6 feet apart and like have the chairs spaced out. We'd all wear face masks and we're outside. That's what we did. We were always outside if we did stuff, and then kept our distance.
Okay.
Mhm.
The next section would be community. How has the COVID-19 outbreak affected your community that you may be a part of, or any communities that you may be a part of? So, like school, clubs, or
Mm.
church and jobs.
I feel like if anything, it's honestly strengthened my relationships with my communities. Like, well, obviously I graduated college, and that definitely was restricted because I went completely online for the last year of college. So it definitely felt like I missed a little bit of that. But I've been in college for like 6 years. So it wasn't like a really sad thing for me. But yeah, I think it's really brought us a lot closer together because we were really determined to get through this together, be strong together, and checking in constantly with each other. Made so many different like uh, like Snapchat groups and stuff. Kept in communication. My mom and I talked every single day. That was our goal. We'd always call each other and talk every single day, which we normally like only saw each other like like once a month or like every other week, that kind of thing. And we didn't talk on the phone too often. So from that to every single day, it was just really important to us to all stay connected. And I think that we've really bonded a lot um, through this pandemic and kind of going through like a collective crisis. It brings people together a bit too. So yeah.
Okay, perfect. How are people
Mhm.
around you responding to the COVID-19 pandemic, specifically in your community?
I feel like they're responding pretty well. I feel like most of the people in my life are taking this really seriously. Everyone's either on their way to get fully vaccinated or are fully vaccinated already. Um, and everyone was doing their best to be as cautious as possible. I had like three friends of all my friends that even got COVID. So I thought that was kind of impressive. And like they were, in an age range that was a little less worrisome, like in their 20s to 30s. So and they were fine. So that was really relieving. So yeah, I feel like everyone just took it really seriously. And now everyone's just really excited about the benefits of being fully vaccinated.
Okay, perfect. Self-isolation and flattening the curve have been two key ideas that have emerged during the pandemic. How have you,
Mhm.
family, friends, and community responded to requests to self-isolate and flatten the curve?
Yeah, I feel like yeah, we did a pretty good job of being as careful as we could without also it's kind of a weird balance between like you want to be as safe as possible, but also like you do need to see people still. We're very social creatures, humans are. And so finding like a good balance between what is safe, like what risks are kind of more worth taking, and then what aren't. A big no for me was parties. So I thought that um, yeah, I had a friend that had a Halloween party, and that's when he got COVID. I was just like, no, and he invited me to. I was like, I can't go. I'm not going to go. You guys don't wear masks. You guys don't social distance. Like I know you guys aren't a safe group to be around. Um, but that was kind of it. I feel like everyone else was really respectful of it, and just everyone just tried their best. I think that none of us were perfect 100% of the time, but isolating was definitely a key component to flattening the curve, and you can really see that in the trends when it's a lot easier to be social distanced outside, the cases kind of go down more. And then when you have to be indoors, but to still see people, see family members, then you're in closer conditions that can spread disease easier. So yeah.
Okay. Next section will be health. You talked on it a little bit earlier, but have you or anybody you know gotten sick during the COVID-19 outbreak? And then what has been your experience in responding to the sickness?
Mm. So, I mean, fortunately, I've been really healthy this last year. My only illness was, I think, due to a bad avocado. So I'm pretty sure I had a pretty intense food poisoning one night, but that's about it. And yeah, same thing with my partner that lives with me. He's also been really healthy too. So yeah, and kind of same thing with my closest family members. I haven't heard anything about them not feeling well. My sister broke her wrist ice skating this winter. So she had to go to the hospital to get that get that bound. And I'm only laughing because she's kind of silly about it. She's never broken a bone before. So it's just kind of a traumatic experience for her, but she's okay now.
What a time to
um, sorry?
I said, what a time to do it too during all
I
this.
know, yeah. And she lives in Chicago, so it's not exactly
Okay.
yeah, the safest place to be. That was something that was really concerning to me also. It's like my sister lives alone in Chicago in a tiny studio apartment, and I was really concerned that of her mental well-being and just being able to get through it. But she's been doing really well, so I've been happy about that. But yeah, I feel like yeah, kind of a funny thing that everyone's been really healthy.
You kind of just touched on it, but in what ways do you think that COVID-19 is affecting people's mental and or physical health?
Yeah, I think it was an extra difficult year for everyone. It wasn't just the pandemic. It's the pandemic's been elevating all these other systemic issues in our society, especially racism and the big civil rights movement that's been going through lately. Well, it always has been, but really has been heightened lately. And I think it's been really traumatic for everyone. It's been, especially after a year of the pandemic, a lot of people are experiencing what we call crisis fatigue at the health department. And we've noticed that too with like working with people. They're a lot less amiable to us. They're a lot less friendly. Everyone's just kind of over it. They want it to be gone. Everyone's just sick and tired of it. And, it doesn't really, it's not really conducive to being really cheerful with one another. So it's been really stressful for everyone. And I think it's taught us a lot about how important it is to have resources for mental health. And that's one of the things we provide too at the health department. We have a bunch of mental health resources that we give people. So, and I think also, I don't know the numbers, but I do think that I've heard suicide rates have been increasing as well. So it's definitely been a really big challenge for everyone in many different ways.
Yeah. Next topic would be the vaccine. Have you or anyone you know had questions or concerns about the vaccine?
Well, I know that recently with the Johnson & Johnson vaccine being paused because of there was a couple cases of blood clotting in a specific group of women. And that's definitely, and we've talked about it at the health department a bit, that it does seem to provide some hesitancy for people. But another really good thing, something that we talked about in some meetings, is that it's a really great proof of a system that is working well. Like the system caught it quickly. These are, vaccines that are definitely being pushed for emergency use, but we have really great safeguarding systems in place to catch things like that. And they paused it, did more research about it, and now they've continued again, but just withholding it from those specific groups that seem to have been affected. And there's still more research that needs to be done on it. So and I've noticed that too. Like I was really honestly disappointed because with my job, I've been starting to transition into vaccine clinics. Some because our disease investigative work was dwindling to the point where we had no work, which was wonderful. We're all like, this is such a great thing that we have nothing to do. And so we were training and transitioning into clinic work, helping all the other parts except for like actually doing the vaccine. I'm not trained to do that. And I've been doing that, but the clinics have like no people there. We have capacity for 1,000 people, sometimes 1,200 people, and like 200 people show up.
Mm-hmm.
And we're like running around the university like, hey, does anyone want a vaccine? We have a couple doses left. We don't want to waste it. Like pulling people off the street basically and get them vaccinated. And it's to the point where they're actually closing the FEMA site clinic because there's so few people that are going. I genuinely thought it was going to be like 1,000 people a day, 7 days a week, all the way through the summer. I thought that was what was going to happen, but they're going to be closing the clinic down soon. It was a really great resource for people, especially people that, it's free, right downtown, accessible, right on the bus route. And yeah, just nobody's getting vaccinated. So yeah, definitely disappointing there.
Yeah.
Mm.
You said you received the vaccine earlier. Did you have any side effects?
It wasn't too bad. My second dose was a bit worse than the first one. The first one I was totally fine. My arm was a little sore. Second dose, I did get really achy, and then the next day I felt fine. And I was, kind of an interesting thing about me. So growing up, my dad was very anti-modern medicine. I would consider him anti-vax, that kind of mentality. So I had none of my vaccines until about 2 years ago. I got into Badger Care, and then I organized with my doctor. I got all my vaccines done in 8 months. I got, I think, 12 different vaccines. And the worst one was the pneumonia one. And like my partner was like, "Oh, like, Aleah, are you okay?" But when I got the second dose, I'm like, "It's not as bad as the pneumonia vaccine. I'm fine." Like, that one was hard. This one was not nearly as hard as that. So I had a couple symptoms, but I was fine.
Okay.
Yeah.
You said also, so speaking about being vaccinated, what was your experience getting access to and for the vaccine? So making an appointment and understanding when it was available.
Yeah, so that was kind of something also that I thought was a little disappointing about how the system went with prioritizing people, because I'm an immunocompromised person with damaged lungs. COVID's very dangerous for me. I've got disabilities with my lungs specifically. And you would think that would be the reason why I got vaccinated so early. But no, it's because I'm a non-frontline worker for a health department. That's why I was able to get the vaccine when I did. And then for availability, I wanted the one as fast as possible. And it was actually a 3-hour drive for me. So it wasn't like super accessible for me necessarily, but I was able to do it just to get vaccinated when I did. But obviously, I mean, I think it was like a week later, the vaccine clinics were opening up. So, but I was like, I want it as soon as possible. So I did have to drive a bit, but yep.
Okay. Next section is information. What have been your primary sources of news during the pandemic?
Well, fortunately, I get a lot of my news from the health department directly. They've been really good at keeping us updated. Other than that, I mean, I don't have like cable, but I watch like news on YouTube, always live videos and stuff about that. I can't like handle too much depressing news. I have to like watch really short snippets, like just get to the key informational points and then pull away, because it gets really sad really quickly, and kind of like important for that mental health balance to not take on too much. But yeah, I would say like those are kind of like my biggest. I watch a lot of YouTube videos, and then BBC is a really good source of news as well. But I've actually been kind of pulling away from news sources the last couple months. So yeah.
Okay. How have your news sources changed during the course of the pandemic?
I guess the biggest change for me is working for the health department. So I guess that would be the change.
Okay. What do you think are important issues that the media may or may not be covering?
Important issues. I don't know. I feel like there's more information than you could ever possibly need.
Yeah.
It really, any question you have, you can Google it. Like, I mean, go through like all the information documents for the health department. Like, there's every single question you could ask, and you can find it, click on it, and there's the answer right there. So I don't know. I'm not the right person for that question.
That's fine. The next section will be government. How have municipal leaders and government officials in your community specifically responded to the outbreak?
Oh yeah, I think that that's been a really interesting thing seeing from the health department. So yeah, I mean, I am funded through grants, or funded. I'm being paid for my job through grants that they got. approved through the state. So, but you know, it's kind of an interesting contrast because right when the pandemic happened, ooh, okay, I should really get a phone charger. Here, I'll do my gas, Connor. Here, sorry, 1 second. I have an iPhone 6, so it drains really quickly. It's fine. I'm just gonna go. I work downstairs. My phone charger's down here.
Okay.
But yeah, so absolutely has been really highlighted how underfunded a lot of these programs are, especially well, you know, this is really pulling out all the information I know, but the Trump administration defunded or completely disbanded there's specific pandemic units, you know, groups of people designed to handle crisis like this, and they pulled all the funding. Oops, sorry.
That's no problem.
That's annoying. Technology. They pulled a lot of funding for public health positions specifically. And I know that, you know, that was like another concern I had. I didn't really know when I was graduating before the pandemic, but just like that vague concern of like, oh my gosh, like these jobs are not very well funded at all. And like, where could I go with work in the public health field? And now there's a lot, there's a lot more importance to it. Funding's gotten a lot better. The Biden administration has been pouring a lot of money into funding public health jobs, specifically with COVID. And, you know, like how I got my job, like, it was funded through programs. So it's been an interesting mixture of like, I feel like the governments have been really scrambling to get these teams together when it used to be something that was already in place. So it's been an uphill battle for sure for a lot of the government organizations.
Yep. And we kind of just touched on it. Do you have any thoughts on how local, state, or federal leaders are responding to the crisis differently? So at like the different levels, kind of.
Oh yeah. Well, okay. So I guess the biggest thing I've noticed is how different it is from like county to county even.
Yeah.
Like every health department has like basically what they prioritize, what their needs are, what they need to do first. For example, the Eau Claire Health Department is really like, it's really shining in like a golden light from the state's perspective, because we have been able to get a lot of people to fill out symptom surveys during their isolation and well, not quarantine, but during their isolation, filling out the symptom surveys of how they're feeling. And then that's like how we determine basically if they're free to go back to the community and go back to work and all of that. So, but for other health departments, it's not as big of a priority because their issues are different. Mm-hmm. So it's really what any local place needs, how to fulfill those needs, especially the more rural counties, like, and like people who don't have email addresses for the symptom surveys, or even like getting emailed about being eligible for a vaccine, you know, all these different I guess access complications that people have. And then you go up higher, go to the state level. And that's something too for our job. We when we have too much work, we send it to state. Kind of an ambiguous term from my perspective, but it's like, I really want to work for the state. It sounds like an interesting perspective to be in. But yeah, they have hundreds of contact tracers, people that are processing all this information, delegating where funding needs to go, funding all the local health departments. And then you go look at different states and how they're handling it. So, and then federally, how they're handling it, how they're handling international issues with the pandemic. So it's a very layered onion of different governments trying their best to work together. And the ultimate goal is to keep people as safe as possible, to hopefully lower the stress on the healthcare system. Because that's the biggest thing. Like if people can have access to the healthcare they need and get treated for COVID, then they have a much better chance of success of surviving it. So that's a huge reason why flattening the curve is such a big goal, because we don't want to overwhelm a really fragile system. So yeah, sorry, I kind of forgot the original question.
And then the final question, kind of just about the future. Has your experience transformed during the pandemic on how you think about your family, friends, and community, and in what ways?
Absolutely. This is something I've talked about a lot. So yeah, it's been a really difficult year for me, and missing my family. It's been like honestly the hardest thing for me. And because of that, I've been practicing gratitude way more than I used to, just being grateful for things that used to be so small. Like I went to a thrift store this week and I got new clothes. I haven't done that in a year. And I also like dyed my hair because I was like, I want to change. Well, it's not that different, but just like these little things. And then, also a little interesting, like I graduated a semester early, and I didn't know that until my fall semester, like halfway through my fall semester, that I was actually graduating that semester. And then, so all of a sudden, I just like had like a month of like, what are my plans? What am I going to do? And now that I am graduated, I'm like, what am I doing? Like, what is my life now? I've literally never been out of school before in my life. I've been in school this whole time. So this is my first time not being a student. I'm fully vaccinated, and I just want to be as free as possible. So what we did was we bought a small school bus and we're converting it into a tiny house. And our goal is to just do traveling full time for like the next X amount of years.
That's awesome.
And yeah, and like a huge thing is like I just want to camp literally right outside my family's house and just hang out with them for a while, because they live a couple hours away. And I miss my family so much. So I want to spend as much time with them as I can. And I also have pets, so it's hard to travel with pets typically. So I felt like this was the best of all the things I needed.
Mhm.
I'm still transitioning. I'm still in my house, obviously, but that's kind of, I don't think I would have made that decision if this pandemic didn't happen. So I miss people so much. I miss traveling. I miss, I just miss having control over what I'm doing, I guess, especially with being a student forever. It's like, there's always homework and everything to feel guilty about if you're not working on schoolwork. So I feel like I'm working through a lot of school trauma right now as well. But yeah, that's like, I'm just so excited for the future. I feel like the name or the word of the year is gratitude, being grateful for every single thing. Like I'm so grateful. I'm going to see my mom on Sunday and get to hug her with no mask. It's like these simple things. Like I never would have thought that I was going to miss that, or like it was just like something I always took for granted.
Mhm.
So I'm really grateful for it. And especially now that the winter's over, I'm really grateful to be outside again.
Yeah.
But yeah,
Right. Perfect.
gratitude. That's my answer.
Well, speaking of gratitude, thank you again for speaking with us.
Yeah, for
Um,
sure.
and then have a good rest of your night, I guess.
Thank you. Yeah. Well, I'm happy I could help. This was a fun experience.
Wow. Have a good weekend too.
Thank you. You too. Happy Mother's Day.
All right. Bye.